I would like to welcome you to tonight's program. This is a program that we do every year, and we are going to get some information tonight on how we can stay healthy and make positive choices throughout the holiday season, which is a very tough time of year. All right, so I would like to welcome our first speaker, Niyati Parekh, who is an Associate Professor of Public Health Nutrition, College of Global Public Health, and she is the Director of Public Health Nutrition, the MPH program at NYU. So let's welcome Niyati.
Hello everyone and welcome. I have a quick question for you. Do you prefer that I walk around? Will you be able to hear me without the mic? Or do you prefer that I stay here and be loud and clear? Mic? Okay, thank you. Yeah. All right, so I try to discuss a different topic every year when I come here. It's always a great pleasure to see all of you. I recognize some of you from previous events or a study that I conducted here, or probably both. And it's always a pleasure to be here today, every year and even today. So this year I thought I'd focus on something different that I haven't really discussed in the past, and that is how processed our food is. And I'm sure we all know that, but we probably don't think about that and stop to think about that every day and every meal, and just how many chemicals we are exposed to. And some of these processed foods and chemicals can actually make our cancer cells grow faster or can induce cancer. So I thought, in the context of your holiday eating, we're so tempted to go and buy candy and sweets and things that look colorful and purple and pink and cakes and cookies, but I think we need to be aware of healthier ways of eating and just what is coming through the food that you purchase every day, but even for the holidays. So I'm sorry that it's going to sound a little more scary than I would have wanted to say, but the wonderful part of it comes from our chef Lourdes, who's also a registered dietitian. So there's no better person to demonstrate some of these things of how you can still have an exciting holiday and be healthy and have a chemical-free, simple food that's really tasty, right? So that's the second part of the we kind of work together so that she can demonstrate the more fun part of what I'm going to say. So industrially processed foods, I want to actually stop and ask, what is processing? What do you think is processed? Because there's a lot of misconception about what processed means. Anyone want to try? I assure you that all answers you give me will be correct, because processing is really a broad term. Yes, the gentleman at the back.
Going through manufacturing.
Going through manufacturing, that is absolutely right, but there's more to it. Someone else, yes?
Increasing the shelf life.
Increasing the shelf life. Well, how would you do that? By adding chemicals, perhaps? By treating it in a certain way?
Yeah.
Okay, so that there's no bacterial growth. Okay. What else? Yes? GMOs, you're messing around with the genes. But so what do you think? You're actually telling me that processing could be all of this. But so what could processing include? It could include, heating foods. It could include preservatives. Yes?
Canning or packaging for long life.
Excellent. Packaging even. Even if something is fresh, it's still packaged in, even your water is packaged in plastics, right? We're not exactly sure how many of the chemicals are leaching into the water. We have to actually keep testing for this, and there are only some chemicals that we know of. There's only some chemicals that we can actually detect, and there may be many others that we don't even know of. Okay, from a nutritionist point of view, I'm a registered dietitian in my past life, and I moved to public health nutrition. And from my perspective, it's kind of a nightmare to say canned food is bad, don't eat it at all, because canned food in some situations, the reality is that's the only food some people might be able to afford, and you'd rather eat vegetables in some form than not eat them at all. So it's actually a very difficult message to sift through, especially in marginalized populations. But as you can see, every single thing, and I want you to, I don't want to pick on anyone, so I want you to think for yourselves, what might have you eaten since the morning that was not processed? If you had cereal, it was processed. If you had milk, it was processed. If you had bread, it was processed. If you had raw spinach, it was kind of processed in the sense that it still has natural, it has industrial chemicals through the soil, which you can't do anything about. So it's not true that all healthy foods are not sources of chemicals, because in some form, all foods, even carrots or spinach or all the fresh vegetables, if they come from soil that has chemicals, then they could actually have chemicals even if they're not physically processed in a manufacturing plant. Okay. It does not include organic. I'm coming to it towards the end of my talk. But I just wanted to explain to you what processing is. And I have a very nice cartoon here. We have to also be practical. And so I'm first laying down some of the definitions, just making you aware of what foods there are and what processing is. And then we'll kind of talk about, okay, how do I manage my food in this world of processing? All right. So I'm kind of coming to that. So there are two kinds of, I would say, ideas in the nutrition world. Some people are like, nothing, it's great. We have it in a can, it doesn't matter, it gives us our nutrients, right? And then there are nutritionists who are like, everything with it is wrong. Because you can get nutrients even from the most unhealthy foods, right? So I think the emphasis on dietary guidelines in many countries over the past few years has not been on nutrients. They're not saying get 10% protein. They're saying get proteins from these sources, right? So the guidelines are trying now very hard to move away from these mathematical numbers and percentages and actually move towards whole foods or food recommendations. So if you use the nutrient approach without considering the source of the food, then I think nutritionists have it much easier, or food industry actually rides heavily on that. They're like, if you eat this food, you'll get 80% of carbohydrates, but what type of carbohydrates? That's a big question, and that's why the nutrition world has to be very active in making sure that the messaging is correct. Okay. So this is the part that is scary, and it's in red, and it says that we have at least 10,000 chemicals in food, about 1,500 that are direct additives that are approved by the FDA. So when the FDA approves of something, it goes through a lot of experiments, and it approves something that can be added in a certain dosage in the food. However, what the FDA is unable to do is look at the cumulative effect of different chemicals at the same time in the body, right? Because you might have chemical A, chemical B, and chemical C. Someone else might have chemical A, D, and Z. And is the effect of chemical A going to be the same in both people? Because it works in the context of other chemicals. That's not something that the FDA can address, and therefore we have to sort of be a little cautious of the approved drugs as well. So there's about 140 color additives, 2,700 natural or artificial flavors that are determined. GRAS is generally regarded as safe. That's what it means. 900 generally regarded as safe, listed, affirmed, or reviewed by the FDA. 1,000 added by the manufacturer. 500 pesticides, and 3,800 other kinds of food additives or contact substances. Especially in the context of packaging. Yes?
What is GRAS stand for?
Generally regarded as safe. Generally regarded as safe.
Generally?
Regarded as safe.
It's okay.
Generally?
Yeah, it basically means it's kind of safe. All right, so I want to give you an example of a natural food, which is corn. Okay, if I just said I had corn, that means, what does that really mean? You could have had fresh corn, you could have had roasted corn, which is slightly different in its nutritive value. You could have had processed corn, which is now stuck in a can with salty brine solution, or you can have Doritos, which are also made of corn. And the company will say, made from corn, natural food. But then it's really, really, really important as anybody to be able to read labels, okay, and see what chemicals are added. If you can see on those labels foods that you can, names that you cannot even pronounce, those are not foods, and you, even without understanding what chemicals they are, you just know that it's really not food. It's something edible, but it's not real food. All right, so we have a Brazilian group that actually took the lead in defining the levels of processing. You have minimally processed foods, which could actually be pretty healthy. Even cooking is processing in a sense, and it could be pretty healthy. When you cook spinach, it helps for some of the nutrients to be absorbed better in your body. The problem is not with minimally processed foods, okay? Washing, waxed apples, all of these are minimally processed foods, but that's not where the problem is. The problem is in somewhat high to medium processing and ultra processing. Can anyone just from the English word tell me what do you think ultra processing is?
Extreme.
Give me an example. So let's start with apples, okay? Apple slices, maybe a waxed apple is processed because it's waxed, it's plucked from the farmer. It might have some chemicals from the soil, but we're saying that's fine right now, right? Because we're choosing between maybe the good foods and the slightly worse foods and the worst foods. Like, we're just trying to pick our battles here. So, but then if you change that apple to apple sauce and then apple cider and then apple juice, where all the fiber has been taken out and it's clear so that you can see through it, and then apple gummy bears. This is all apples, and it can be classified as apples because they're made from apples. But is a gummy bear it's the ultra processed version of the apple slices, and you can't really put them in the same category. So it's those ultra processed foods that are really concerning and have actually flooded our markets. The Wonder Bread, the Twinkie bars, everything that has so many chemicals that are listed in the label. So if you don't read labels, I think it's an important exercise to do that. And we're going to do a little fun activity at the end of when I finish my slides to see what, if you can read labels. Okay. So there are many controversies around processed foods because on one hand, the belief is that if we don't use processed foods, we're never going to realize our goal of feeding everybody. So there's that reality, balanced by the fact that the more processed food that gets into our food systems, the more processed foods that is being produced by our food companies, the more chronic diseases we are seeing, and it has so many all the chemicals put together are very detrimental for the development of various diseases, and I'm going to get into that a little bit. Okay, the people who are for processed foods are obviously a lot of the food companies, and none of us can live without them, but I think it's about trying to minimize their use. So it's convenient, it's affordable, it's time saving, and we're seeing that much more in New York City, where you can even go and get an apartment that barely has a kitchen, right? Because you can just open a can and shove it into a plate and microwave it, and then you're done. Okay. Most people think it's safe because it's packaged by industry. It's packaged carefully, it's treated, make sure that the shelf life is long, all of this kind of stuff, and that it's essential for food security. So these are the people who are saying we must have processed food, and I think I'm trying to say that we have to really think about it and do something in the middle. Those that are against processed foods will say that they're contributing to obesity, chronic diseases. There's a lot of artificial substances with risks that we have no idea about because there are limits to what we can detect. We don't have proper systems to detect some of these chemicals, right? So I kind of went into all of that. And I'm not going to go through this slide, and you can't read it very well, but you might have it in your packets. These are just examples, more examples of foods by processing level. Okay, but what comes under ultra processed foods is soft drinks, breakfast cereals, salty snack foods, some breads, cakes and cookies, canned and instant soups, and some energy bars. Okay, so I also want to say that the people who are which is mostly the food industry, who are trying to market processed foods, do a really good job of marketing them to people who totally shouldn't have it. So there's so many food ads directed towards the youth, and I know this doesn't apply to a lot of you, but you have families with children, and it's something important to know. So foods, beverages, restaurant ads, all the mini meals, all the special deals and discounts are usually targeted towards children, which helps them to actually increase their consumption of ultra-processed or highly processed foods. Okay, there's also many more TV ads, and we don't have that much law enforcing that you cannot show those ads at certain times of the day to ensure that the children are not viewing them. So Coca-Cola says it doesn't market to children, but I think it does. Okay, so this is just another example. And if anyone here is from Coke, it's okay, I have enough evidence to fight you. Okay, these are some studies from the Rudd Center, which is a center that used to be based in Yale that has now moved to the University of Connecticut. They do very high-level food policy work with food lawyers and health lawyers that are really specializing in food law. And they undertook this study to look at what are the top 10, this is many years ago, what are the top 10 cereals that were bought or purchased in supermarkets. And you can see that they're all super processed with lots of colors and sugars added and so on and so forth. And this is how it changed a few years later. It's the same products that just kind of shifted in their ranking of what was sold. So labeling practices, I think this is where it's very important for all of you. Anyone who's had chronic diseases or of any sort here in this room, you know that they play on your psychology by saying pomegranate added. It's a antioxidant. And if you actually look at the labels, which is an important part that I'm going to teach you today, you could have 2 tiny little grains of pomegranate in there, and it has pomegranate. They've checked the box. They didn't lie to you. But that doesn't exactly make it the #1 antioxidant drink. But they put a big picture of that on the front of the bottle, and you think it's one of the healthy. So they're kind of playing with some of this. And if I'm not exactly sure where the laws are about health. Health claims, but they've managed to find a way into the market with some health claims. So just an anecdotal example, I was at one of the tea places the other day, and they said, and I said, no, how sweet is that tea? Because some of them have syrups that they kind of pump in. And believe me, they say it's so many calories and all of that, but they're not really looking. They'll just go dab, 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 and like whatever falls into it. Same thing with alcohol. They don't have, like in Europe, they actually portion out the alcohol, but over here they're just going, so you don't really know how much of soda, alcohol, sugar syrup, all of this you're getting. So I said, I don't want that thick sugar syrup, and this guy said, oh, this is the healthier sugar, and it's agave, and I said, I have a PhD in nutrition. And he said, okay, well, then it's not healthy, because I think they just try to, the new rage is agave, it comes from cactus, but by the time it's processed all the way through, it's not different from sugar in the way your body sees it. So again, these are just marketing strategies, and it's whatever the new rage is. So as a consumer, you have to be really careful about that. Similarly, with all natural vitamin C, it's my favorite line. I always say even tobacco and cigarettes are natural, right? Yeah. So read ingredient lists, and we'll look at a couple together. Well, in this one, you can see it says gummy bears. It says sodium citrate, coconut oil, natural and artificial flavors, carnauba wax, red 40, yellow 5, blue 1. I've already read 10 that are bad enough, and that's it. Okay, I'm not saying never eat a gummy bear, but be conscious of it. I think just a self-study of what you eat every day from the time you open a can is going to help you change your behaviors. And small steps are important steps. Okay. So there's some, this is the claim about the, juice, the apples, the berries, that I was giving you an example of. If something is raspberry flavored with unnatural chemicals that flavor it, and they might have a raspberry picture on it, don't be fooled by it. A lot of people tend to pick up, at least in this country, we have a different problem, like that it's the understanding exactly of it. But where I come from in India, people cannot even read, right? So for them, they're only going by pictures. Some strata of people cannot read. I take that back. I don't want to make it sound like the entire country is not literate, but there's a very large population of people, especially women, who have not gone to school beyond a certain time, and they have problems with understanding higher level concepts, and they cannot read. But having said that, even here, if I ask you what is a calorie, are you able to tell me exactly what that means to you?
A measure of burning energy.
Okay, so is 300 calories versus 800 calories? What is that information?
300 is less than half of the 800.
That's great, but what does it mean to your body? I think that a lot of assumptions are made. They have to, again, check the box and say, we put it on the label, but do people really understand it, right? The whole calorie labeling initiative, it's there. How many people read it? Is it really visible? Do they understand what that means? To a lot of people, and especially those who are food insecure, and we know that that's also a really big issue, and with health disparities in this country, they said, wait, I don't know where my next meal is coming from. Why would I spend $2 buying just 300 calories when I can actually get 800? So the messaging works in the opposite way. And again, it's a problem with the messaging. The labels is a form of messaging. The calorie labels is a form of messaging that people don't always understand, and food companies can get away with it. Okay. So just so you know that it's mandated that there are going to be labels that have to look different now, so that the number of, the caloric value is actually bold and big. The previous labels didn't really cut it. And they have to now add information on added sugars. Earlier it just said sugars. In juice, sugars would, we don't know whether there is added sugar or not added sugars. In certain products that were based, like fruit-based products, we didn't know if there were added sugars, but now they have to explicitly tell us how much sugar there is and what's added, okay? They are also trying to make the message clear about serving size, which I know this has got too much to do with, processing level, but, I'm just, because we're at the label, I just want to throw this in there, that it's really confusing. You have to probably walk around with a calculator and say, it has 200 calories per serving size. And then you have to figure out, but in this box of Pringles, how many servings are there? So if 4 pieces of chips is 1 serving and you had 16 chips, then you've had 4 servings, and therefore you have to multiply the calories by 4. I've already lost you. And this made no sense to anybody, and not even me, because I don't walk around with a calculator when I'm hungry, right? Even if it's on my phone. So now they're supposed to tell you, give you more precise information about how many calories are there in that entire Pringles box, so that you can avoid the calculation, and plus how much it is per serving, okay? Because some people get 1 box and eat the whole thing and think they've had 1 serving, when it was actually 10. Right? So they are supposed to tell you how many servings are in a box. So again, all of these are issues that are connected not with foods that you find in nature, right? There are no labels on your tomatoes. There are no labels on your apples. There's no limit to all of this. Like, you can eat as much as you like. But anything that has a label, you have to be kind of conscious of and understand better. So what's the big deal about all these chemicals that have been, going on and on about? Some of them act like hormones, some of them mimic hormones, and some of them actually participate in our biological pathways just like the regular natural hormones would. So what does this mean? This again is kind of a diagram to show you that hormones act on every organ system, right? In so many different locations and sites in our body. But what does this mean to generally for a child who's growing up? It could impact obesity rates because obesity is tied to hormonal mechanisms. It could actually influence their puberty. There is the whole talk about the falling age of puberty, and the puberty is definitely a hormonal issue. In terms of adults, again, chronic diseases are hormonally linked. Heart disease, obesity, cancers. So when some of these chemicals are basically, replacing your hormones, or your hormones are released in response to certain body signals. But these are not released in response to body signals. They just enter your body because of the food that you've eaten. All right. So that's why it becomes important for the cancer and the chronic disease cycle. Okay. Now, the not so good news is that some of these chemicals are persistent. It's not like you ate something and the chemical got out of your system. No. Some of them can actually bioaccumulate, right? So you can get these chemicals from meats, from fish, but it also accumulates within the fat cells of your body because the fat is sitting there for a long time. And if these chemicals dissolve in fat, they're trapped in the fat and they remain within your body and they persist. Some of them are persistent chemicals. They persist in your body much after you've eaten the foods or after the chemicals get into your body. And bear in mind, you don't only get chemicals from the water and the food, but you get it from your lotions, you get it from your shampoos, you get it from your soaps, you get it from, breathing the air that you breathe around us. So I'm only talking right now about the chemicals that come through your food, but there are other sources, and all sources of chemicals can be either persistent or not persistent. I've already kind of discussed what generally recognized as safe is, and I'm going to go into that. But I want to, say that about 70% of what we eat is processed. Go to the grocery store next time, or look at your grocery list and check off on it what you think is processed and what you think you can change. Like I said earlier, there's about 10,000 chemicals that are allowed as ingredients in either packaging or processing of food that we even know of right now. And some of these are pesticides, PCBs, which are polychlorinated biphenyls, which are replaced by something, they say no BPA, BPA free. How many of you are aware of that? Raise your hand. BPA free. And we'll say, okay, good one to buy. But it's replaced by BPS instead of BPA, and we know nothing right now in detail about BPS and whether it behaves the same way. Now, from being a mother of 2 young kids, I used to give my children pacifiers. If I had to feed them something through bottles, the bottles were made of plastics, rubbers. They didn't have BPA, but they had BPS. I'm still not sure what went into their bodies, right? So it kind of starts at a very, very early age, and it's not the tradition in many other countries to actually expose your children for long stretches to plastics. And children's things are intentionally made of plastic. Yes, ma'am?
They have to say BPS if it's been replaced?
It'll say somewhere there, but it'll just say BPA free. I'm not sure if
They
they...
say BPA free, I don't see anything about BPS on these things.
Well, it's typically replaced by BPS. If it's BPA free, they can't only remove that ingredient. It has to be replaced by something else to give you the hard plastic. The harder the plastic, the worse it is, by the way. Yes.
So people using BPA free are getting the BPS and they don't know what it consists of?
Nobody knows what BPS is capable of. We only know that BPA causes some harm, and that's why it's taken out. And like I said, FDA can only tell you what FDA knows, but we just don't know.
But if they were, so that means that the BPS is not approved by FDA?
I think they're still studying it. They just wanted to get BPA out because that was creating a lot of trouble.
I had no idea.
And I don't think that anytime soon, with the the problems that our current administration has with the EPA, that this is going to be resolved anytime soon.
But I don't think that's right what they're doing. I mean, they're supposed to inform us about things.
I couldn't agree more. That's right.
Just tell
at least it's my job to try to reach out to as many people as I can as a professor in this field, and that's the best I can tell you. Yes.
I use a shampoo and a conditioner that come in very hard plastic containers. They're all purple, they're cute.
Right.
Is that something that I should stop doing because the shampoo stays a long time?
Yeah, I mean, I think I'm gonna come back to that if you don't mind, because it ties into some of the things I'm gonna say. So these are just examples, and you have the slides to take home, of heavy metals, phthalates, phenols, some of the very widely used chemicals that can actually come to you through various different, carriers, food or otherwise. Okay, so this is exactly what you're waiting for. So what should I eat? Like, don't stand here and tell me there are 10,000 chemicals. So there's no perfect chemical, right? Because even if something, like I said, some of them persist, they're persistent. So there's no perfect food right now, because it could bioaccumulate, even if you lived in rural areas where there's like no house next to you, somewhere in the Arctic, it still happens to be found in their blood and their bodies because of just how connected everything is through their water sources, through persistence, through bioaccumulation. So I think living in New York City may be a slightly more of a disadvantage because it's so urban and we have so much of this, but I'm saying everybody around the globe is facing this. So what should we eat? I looked up some of the consumer sites, and this is the Dirty Dozen, and these are the fruits that have the maximum number of chemicals in it. So these are the ones, if you have to spend your money on organic, these are the ones that you would get organic, because at least you know that it's not there in those soils. Now, this is not always the case. A lot of people cannot afford to do that, and we at that point we'll say, okay, listen, this is a tough one. You'd rather eat the frozen berries that are available off season, because seasonality makes a big difference in many countries, probably not in New York City, because you can find strawberries 12 months in the year, nice big red ones, right? So I just want you to take this list away, and coming back to your question about shampoos. So there have been consumer websites. If you Google, there's many different ones, and I didn't bring that information directly here to you because I was focusing on the food. That will tell you which products to use. Some companies, and again, I'm not allowed to endorse companies, but as an example, Whole Foods will have some organic shampoos and soaps and lotions, or other stores which are similar. And if you think it's a good investment, you even have mattresses and textile that are now made chemical-free. Mattresses are usually, sulfurated and all this kind of stuff, and you have organic mattresses. I know you're probably wondering, it's not food that goes into my body, but you have things made of natural, materials, and it's totally up to you to what extent you want to do this. I'm at least saying food because it's so basic and it goes into your body every single day, right? So there are a bunch of everybody has kicked it up a notch and has made it a point to discuss what some of the natural sources are, even as an alternate to, and you have to consult your doctor. You can't be treating cancers with natural essential oils, but even, simple colds and simple things for which you don't truly get, it has to run its course. Maybe you can consider using some essential oils rather than trying to use drugs, because that's another kind of chemical. So, and we're not even talking about supplements and chemicals and pills, but they're chemicals. Anything that's a chemical is a chemical, and anything in a supplement is never the same as your whole food, okay? So that's kind of where I'm coming from. I do want to talk about alcohol. What I do want to say about alcohol is, how many of you heard it's heart healthy and you make it a point to have 1 glass of wine every day? Or I'm exaggerating, but you at least tell me if you think 1 glass of wine is healthy for you. How many of you have heard it's heart healthy?
I've heard that, but I'm not sure about it.
Okay, so here's the deal. Again, this was a very political issue because the alcohol industry would go nuts if some of the research was, opposite to what they wanted to hear. But the truth is that it only showed in some studies, which were typically done over 3 months. So multiple studies actually were done in over 3 months that were randomized controlled trial, where a bunch of people were said, drink your glass of wine every day, and others were told, don't drink anything. And we want to compare your HDL and your cholesterol and your triglyceride levels. And while there were some differences in those blood levels, there's actually no literature that shows that HDL levels cause or prevent heart disease, right? It's not causal. There are some linkages, but it's not causally associated with it. It's just something that is an observation. However, that said, no one, and hands down we know in the literature, and no one tells us that alcohol is actually, even 1 gram of alcohol can increase the risk of DNA damage, which means it can increase the risk of cancer cells growing and thriving, and it's conducive to cancer. So the Million Women study that was done in the UK, hands down, showed it doesn't matter what kind of alcohol it was. When there's alcohol, it can create an environment that's detrimental for cancer cells. So I think just it's a very mixed message. Maybe it's heart healthy, but there's no causal link. And I think the whole message of even, for Breast Cancer Awareness Months, you have bars that sell pink drinks with cherries. And I'm thinking, really? The Million Women study and many other studies and any literature in the cancer guidelines, the American Cancer Society, the American Institute for Cancer Research, everybody will say, no alcohol. If you drink it, it's okay, but don't start drinking it, because the same age group is getting advice on heart healthy, and people will have a Mediterranean diet with a glass of wine. And what the Dietary Guidelines has done is taken out the language intentionally on alcohol from the Dietary Guidelines. But it was done so subtly. They won't scream like I am and say that the guidelines are taken out, because it's a very political situation with the alcohol industry. Okay, so if you want to support breast cancer, don't have pink cupcakes with so many chemicals or a pink drink at the bar. I think Lourdes is going to show you some better stuff there. So this just goes into the dietary guidelines for Americans, for diet, from the government, the American Heart Association, the American Institute for Cancer Research. I think it's all kind of consistent with what I'm saying, but it's worded very carefully, okay? Alcohol increases this is not me saying this. This is the expert panel report that was written by over 18 scientists, that alcohol increases the risk of colorectal cancer, breast cancer, liver cancer, mouth, pharynx, larynx, and esophagus. These are confirmed links, and it's suspected that there are other cancer sites where it increases cancer risk.
Did
Okay.
they talk about how many drinks?
Even 1 gram of alcohol.
Even one little drink?
Well, the thing is, in this study, they said every gram of alcohol you consume is going to slow down DNA repair. 1 little drink every now and then is fine, but they're not recommending that you start drinking for health, for heart reasons. It's a mixed message.
I don't drink, but on my big birthday I had.
That's fine.
I had-
Yeah, you're allowed.
I had liqueur. No, I didn't
Just
have
carry on with
liqueur.
your
I had
lecture. You ask the
liqueur
questions
on the
later.
rocks.
Yeah.
Some liqueur on the rocks.
That's fine. That's fine. Maybe on that day you'll just decide not to have other chemicals.
Is that better than other alcohol?
Actually, we don't know systematically whether, it depends not only on the type of alcohol, but the amount of alcohol, what it is drunk with. That's a great question. I'm glad you asked it, because sometimes alcohol goes with sugar sweetened beverages. So it depends on what's eaten with it. Is it fish and chips, or it's the whole meal? To me, I think it's the alcohol, how often you drink it, what you drink it with, and how many you have in a day. So like 4 alcohol drinks over the whole period of a week, 1 every day. I'm not saying you should do this, but as an example, is better than having 4 in one sitting, because the alcohol pattern of drinking really matters as well.
I don't drink.
That's fine, you're fine. You can wish yourself happy birthday. So now I think we're moving to a less depressing part. Actually, would you mind if, do you want to go last, Aloni, or? Wait. Okay, why don't you go after them? So, first we have Lourdes, who I guess you will introduce, who's going to show you the fun part of what I said. Her task was to look for natural ingredients and make the food as fun as possible so that you feel like eating and simple enough that you can make. But after that, I have my research assistant, Alomi. We're running 2 studies, and if you're interested in a lifestyle change, please stay back and talk to her and give her your contact details, because we're going to do an intervention where we'll explain to you about nutrition and chronic diseases and help you make some healthy changes. So she's going to talk to you very briefly at the end of Lourdes' lovely demonstration. Enjoy the food, and I hope that I opened your eyes and didn't scare you too much.